Hi everybody. Welcome back to Regina's World. But this one is of course my special video of the month, all about Medicare, right? And this one I'm gonna talk about actually Part D because I'm gonna start with Part D because this is the one that I have the most experience in because this is the one that I actually do and work for a company called WellCare Insurance um, every day of my life, every day, Monday through Friday. That's who I'm working for. So I have a lot of experience in this department. So I don't have to pretty much do a lot of research on it because I pretty much know, I know a lot about it. So just from what I know, I'm just gonna tell you guys what's Medicare Part D, how do you get it, and all that. So if you're interested in this video, continue to watch. And I'm not gonna hold you guys I'm gonna try not to hold you guys too long. I'm gonna get right to the point and get you guys right on out of here, okay? All right. So today again, it's a Medicare Part D, D as in dog. All right, so let's get right into this video. All right, so first off, Medicare Part D means it is your prescription drug coverage. So Medicare, of course, have four parts. Medicare Part A is hospital. Medicare Part B is uh, doctor fees. Medicare Part C is your Advantage plans, and Medicare Part D is your prescription drug plan. They're all separate. So for those who are turning 65 and who think all of it is one, it is not. They're all separate. They individually pay for individual things. So unless you have assistance or supplements, and if you watch my last video, you'll be aware of Medicaid and extra help assistance for prescription drug coverage to help you pay for those things, or SPAPs, you know, or things like that to help you. It is your responsibility to pay for your plan. So how do you get Medicare Part D? You have to have Medicare Part A and B to get D. Period. You have to have Medicare Part A, B to get D, to qualify for D. Or you have a disability, they put you on Social Security, and they automatically give you Part D because you have a disability and use Social Security, so you automatically qualify for Part D. So either one. So you turn 65, you got A and B, and you qualify for Part D. I'm gonna say something right here. So it's once you turn 65, you're required to get it, right? You're supposed to get Part D, or you will get a penalty called a late enrollment penalty if you don't get it when you have the opportunity to get it. And a lot of people don't know that either. So as soon as you turn 65, you get your Part A, you pay for your Part B, and then you say, "Oh, I don't want Part D right now." Okay, because it's an option. You don't have to have Part D, but you kind of do, because if you don't get it, Medicare is going to penalize you, and then all of a sudden you're going to, once you sign up for a Medicare Part D plan, maybe let's say a year later, and then they quote you a premium, let's say $26 for your plan, and then you get a letter say you're getting a late enrollment penalty, which is $50 plus on top of your premium, and you're like, what is this? And you're trying to fight tooth and nail for it, but you went more than 63 days. If you go more than 63 days of continuous coverage after you become eligible, you will be applied a late enrollment penalty for however long you go without it. So if you go without it for a year or two or 10, that late enrollment penalty is going to be applied. Now, how they calculate the late enrollment penalty, not that good in math, so I'm not even going to go into that. But they do calculate it by your income, and that determines how much you're going to pay. Sometimes it's as low as $1, and people don't even recognize that they even have a late enrollment penalty. Others, of course, it's very expensive, and they do take notice. Sometimes it's too expensive, and they be like, you know what, I could just do without it. I use GoodRx, and that's an option too for a lot of members. But again, I say once you become eligible for Part A and B, enroll in the Part C. Even if you enroll in the Part D, even if you don't use it, get the cheapest plan you have. $10 that the company have, $10, $15 a month, that is not going to kill you, even if you don't use it. But it prevents you from paying that penalty down the line. So other people opt out if they're still working and they're still getting employed by employer group coverage. So you don't need it then, right? Because you're still employed and they're still giving you prescription drug coverage. So that's a way to prevent you getting the penalty because you're still getting covered by somebody else. So when you do, that plan is going to stop, and your new plan for Medicare Prescription Part D is going to start the next day. Once that plan ends, let's say that plan's in October 31st, your Part D plan is going to start 11/1. You get what I'm saying? So keep that proof. That's another thing. Keep the proof. So if you have employee group coverage when you're retiring or whatever, keep that proof, because if let's say if Medicare do say you have a late enrollment penalty, they're going to ask you for proof of that you did have coverage. And sometimes it's hard for people to provide that proof because it's been so long. So keep that proof in a folder, whatever. Keep that proof. You need all the proof that you need to avoid a late LEP. Okay, and it's very hard to get off. When it gets on, it's very hard to get off. It takes months to get off. It is not an easy process to get an LEP off of your account. People be crying on the phone to me because they be fighting so hard to get an LEP off. But we can't do anything about it until it gets taken off. And sometimes the outside source, because we outsourced that to a whole other company. And that company is not an easy company to work with. So if that company is just not moving fast as you want them to move, it could be 6, 7, 8 months, a whole year if it bypass, and you're still fighting trying to get that LEP off. So just do whatever you can to avoid it. If you listen to anything, just get a plan. Just get the plan, whether you use it or not, to avoid the LEP. Okay? Okay, so let's talk about do Part D's have premiums and deductibles? Yes, they do. So I'm gonna use my company, WellCare. WellCare have, I think, 5 plans. They have the Value Plus, which is the largest plan, the plan with no deductible, 0 deductible, but the highest premium depending on the state. So I've seen it go from like $60 premium up to like $100 depending on the state. So remember, no deductible, but a higher premium. Then we have the Classic and the Saver plan on WellCare. Those two have a deductible between like $385 and $445 that you have to pay up front. So let's say you are getting this plan. Your plan starts January 1, 2022. As soon as your plan go into active and it goes to the pharmacy, you go pick up medication. All your prescriptions, it could be a tier 1 like a levothyroxine. That's a tier 1. That's usually a $0 medication at the pharmacy. But if you have like a Classic or a Saver who has a deductible that you have to pay up front, as soon as you get it, those same prescriptions that's usually $0 can be $20, $25, $30, $35, $40, $50 because you're paying off your deductible. And a lot of people don't understand. They call, why is this medication? I've never paid this much for this medication ever. You have to explain you have the deductible. So again, you have the Classic and the Saver. Those are our cheapest plans, but they have a deductible that you have to pay up front. Then we have our Wellness RX and Select plan on WellCare, which those two are my favorite. Select plan is actually my favorite. It's a little bit it's kind of in the middle. So it's not expensive and it's not cheap either. So it's like right in the middle. So you could get it depending on the state. It could be as low as $15. It could be as high as $30. So it's not really, depending on looking at elderly people's income, it's right in the middle, right? But that one does have a deductible on tiers 3, 4, and 5, and we'll get into tiers in a minute. So let's say you're, as I said, levothyroxine, amlodipine, things like that, or tier 1s. Your amoxicillin, generic Tylenol, stuff like that. Those are tier 1 drugs and tier 2 drugs, right? So the deductible isn't applied on those. So they're still going to be either like $0 or $3 medication. So nobody's going to even notice, a deductible. They probably don't even know they have a deductible if all of those medications stay the same throughout the year, never changes. But let's say that same person who has those medications all of a sudden get diabetes and they need insulin now. Insulin is a very expensive medication to make, to create, to distribute. So once you get the insulin, and let's use what's one that I see all the time? Oh God, Xarelto. Is that an insulin? I want to say this an insulin or something for high blood pressure, right? Quote me if I'm wrong. I would have to look that up. Let me look that up a moment. I'm gonna look that up. Hold on. Okay, so we're gonna use Novolog. Okay, I had to think about it. I'm like, insulin's Novolog, Lovalin, FlexPen. I was like, I know this. Okay, so I'm going to just use Novolog, right? So Novolog is a tier 3. So for the same individual who now have to get Novolog, now they have a deductible now. So let's say the deductible is $445. So now they go get this medication. It's their first one. WellCare sometimes charges the whole $445 on this one medication at the beginning of the year, or if that's their first time getting it or picking it up, and that's their only tier 3 med, they just charge the whole $445. It is like really expensive, and some members pay for it. Other members don't because they don't know what the heck's going on. Other members who is used to it and they know at the beginning of the year that they're going to have this high deductible that they have to pay, they just pay for it at the beginning of the year and get it over with. Others who run into the situation who never had a tier 3 or never had to meet their deductible, they call us and we have to explain that they have to meet their deductible first before the copayment for this medication changes. Then they understand. Sometimes they get it, sometimes they don't because they can't afford it. So now we move on to what else plan we have? We have the classic, select, wellness. I think that's it. I think that's our plans. So you have your premiums. So again, your premiums is what you have to pay monthly to keep the plan or anything or whatever. Your car note have a monthly, car cost. Your rent, you have to pay this monthly. Your PDP plan, you have to pay it monthly too. So you can do it several ways. They give you options. Since they're elderly, they give them options so they have to think about it, to have it deducted directly out of their Social Security check. They have recurring payments, electronic funds transfer, where it comes directly out of their bank account, where they don't have to think about it. Or they have the right to call and make the payment monthly, or they can do it online at wellcarepdp.com. So they give you options of how to pay for their premium. If you lapse on this premium, now it's not like a normal plan. So this is something a lot of people don't know. This is not a normal plan. This is Medicare. So if you lap on a normal plan, you just pay off and get back on your plan. Medicare is a little different. They're a little different, okay? So if you lap with a Medicare, you only can get back into your plan if you have a special election period. And that is a reason, like a reason, in quotation marks, has to be a reason for them to say, okay, we'll have to let you back in. So number one reason, it could be your hospitalization. Number 2, a death. Number 3, a disease. Number 4, COVID. Number 5, natural disaster. Something like that. I think it's like one more, like if you got a divorce and your finances changed, or you went to go, you were taking care of somebody or something like that. Something had to happen in your life for them to grant you reinstatement. They will not grant reinstatement for a failure to pay, because according to Medicare, no matter what, they don't care if you was on recurring payments. They don't care. They feel it is your responsibility at the end of the day to make sure this premium is paid. So if you're not checking your bank account, that is not our problem. That is not our problem. That is your problem. So we sent you letters letting you know it is up to you to read those letters and call us in an amount of time so we can fix it, so you can pay your premium before we terminate you. Once we terminate you, that is it. You're not getting back on until AEP, which is around the corner in October. But a lot of people is going without coverage right now because of that reason right there. They were terminated for failure to pay. They couldn't pay. They decided not to pay, or they thought they was on recurring payments and it got canceled and it wasn't, and it didn't get paid. We had to turn a lot of people away at the beginning of the year because of that one situation. So make sure you pay your premiums, people. Make sure you pay your premiums. Okay, so let's talk about medications a moment. So we have a lot of people don't understand this, what tiers are. So I didn't know what tiers mean. When you go get your stuff from the pharmacy, that's the last thing I'm worried about. I'm just worried about, is it going to be covered or not? And do I have a co-payment? That is the only thing that I really care about. But I learned that each medication has a tier. So tier 1 meds are your generics. Tier 2s are your preferred generics or your brand generics. Tier 3s is your brand drugs. And this is getting your Xareltos, your Novolog, your Novolins. These are brand drugs. And most of the time, your brand drugs, you're getting to the more expensive side of your medications. So the co-payments are different. So again, tier one drugs is your generics. So they're usually $0. Your tier twos is your preferred or brand generics. And they usually have like $3 copayment for a 30-day supply, $9 copayment for your 90-day supply. When you get to tier threes, then you have your brand drugs. So after you pay off your deductible, because once you get to your tier threes, you're going to have a deductible. You have to pay your deductible on your tier three meds, tier 3, 4, and 5. So after you get your deductible out of the way, whatever that may be, it could be $385, it could be $445. But once you pay off your deductible, then there's a copayment. And then the copayment is usually $47 for a 30-day supply or $141 for 90. And some of our plans on Welker have senior savings discount. That's on certain plans, and that is for their insulin. Their insulins do not go above $35. And I think that was a bill that was passed in Congress. I don't know if it was with this current president or Obama, but that was a bill that was passed. So we had to implement it, and I think probably all of the plans and whoever have a PDP plan have this on their plans. So certain plans do have the seniors discount, so their insulins do not go over $35 because insulin is an expensive medication. So it does help a lot of members who's diabetic and who needs their medication, because some members just can't afford $141 for a 90-day supply. Then we have tier 4 medications, which it usually ranks between. Now you're falling into a percentage now when you're in tier 4s. So let's give you an idea. So a tier 4 med is like testosterone. I think testosterone is tier 4. Or estrogen and testosterone. Oh, actually, I think estrogen is a tier 4. I think testosterone was a tier 3. So I'm gonna use estrogen. So estrogen is a tier 4. So after you, once again, let's say the lady who wasn't paying her deductible. Now her deductible prescribed her, I need you to take this estrogen. So they come get it. She had to pay her deductible, and she thinking this price is going to go down. No. So once you get into tier 4s, it's a percentage. So let's say that percentage is 47% for a tier 4 med. And let's say that tier 4 med is $1,000 to make. So if it's $1,000 to make, you times that $1,000 times 0.47, and that is how much your copayment is going to be for that medication, right? And you got to break that down to the member, and I break it down to exactly like I'm telling you. I tell them to go get a calculator so they can physically see exactly what I'm saying versus me just telling them. I tell them, get your phone, get your calculator right now so you can see exactly what I'm saying. So this is how much is your copayment going to be while you get this medication. And same for tier 5s. Tier 5s are usually cancer meds, and we see them, but not a lot unless the member have a cancer. Really, sometimes members do call in and say they have they're dealing with that situation, so they need their cancer drugs. So tier 5s, I believe, if I'm remembering correctly, it's 25%. It's 25% with tier 5. So same concept. So if the member needed cancer meds, it's a 1,000 times 0.25, and you get your answer, right? So breaking it down to like that so you guys can understand how medication is when you get it from the pharmacy. So some people who have Medicaid, like myself, is very lucky because Medicaid paid for all of my prescriptions, and I really don't have to, and all of my doctor fees and all of that stuff. So I really don't have to think about that stuff. But if I had a plan like Obamacare or Blue Cross or something like that where I had a copayment, then I would really be thinking about that stuff, because I would usually have co-payments for certain medications, and I know this. So that's good information for somebody who is not educated on plan tiers and medication costs and things like that. I hope this part of the video is going to help you. Okay, so again, depending on the plan that you choose, it goes into stages. So it goes in deductible, initial coverage, catastrophic or donut hole. No, let me start over. Deductible, initial coverage coverage gap donut hole, and then catastrophic. So deductible could be 445. I don't know if this is coming on the screen right now because I'm gonna try to edit it where it is so you guys can see what I'm saying. If it's not, just follow along, okay? I didn't figure it out, just follow along. So again, deductible 445. Once you meet that 445, you fall into initial coverage. Then initial coverage is a copayment. You're responsible for 20%. The insurance pay for 80%. So it is your copayment. So again, you could be paying $0 for your tier ones, $3 for your tier twos, 47 for your tier threes, and percentage for your 0.5. Now you fall into coverage gap donut hole when you meet the dollar amount of $4,130 for the year of 2021. Last year was different. I think it was a little bit less. I think it was just a little bit less. But this year is $4,130. So that is how much you pay for the medication and how much WellCare pays together combined. Combine the total amount of $4,130. How do you get that, you ask? I used Xarelto earlier because Xarelto is a very expensive blood thinner. It is a very expensive med. So anytime somebody gives Xarelto or Eliquis, those two right there, Xarelto and Eliquis, are very expensive. So it could charge you when your initial coverage, it could charge you $47. But that same medication, WellCare is paying $1,500, $2,000 for that same medication for a 30-day supply for that same medication. So remember, you only need $4,130. If Xarelto is charging $2,000 for that medication, if WellCare is paying $2,000 and you're paying $47, you get it one more time, you're already in coverage gap. Do you see how fast that is? So you get 2 times Xarelto. Your plan just started in January. You get Xarelto twice plus the other medications. You already in coverage gap donut hole. Now you're responsible for 25% again of how much that drug costs to make. And now it's all of your drugs when you're in coverage gap, not just that one, but all of your drugs, right? So all of your drugs prices is going to change. Your tier 1 and 2 drugs, you may see it increase a little bit. Sometimes it actually go down because again it's 25%. So let's say the drug only costs $20 to make, is 25% of that. You're only paying a few dollars, you know what I mean? So sometimes it go down, sometimes it go up. But your tier 3s and above, you're definitely going to see an increase of those. Those same medication can go from $47 copayment to shoot up to $500 while you're in coverage gap. And people see it, and I see it happen all the time. And I have to explain what's happening all the time to members, all the time. So once you fall in the coverage gap again, you're there until you reach another dollar amount of $6,550 for the year of 2020. $6,550. And once again, that could possibly, depending on where you are in the year. Some people right now has fell into the coverage gap, and they ask me every day, how long am I going to be in it? I said it kind of depends on how long it takes you to reach $6,500 really. It could take you a few months. It could take you for the remainder of the year. But expect that is what's going to happen. If you're lucky enough that you fall into catastrophic, then catastrophic is the greater of 5%. It's the greater of 5%, I believe, or $3.60. I barely ever see people fall into catastrophic, so I always struggle with catastrophic. But I'm gonna have it here, just in case. I'm gonna have a little screenshot of it here anyway for catastrophic phase. I'm gonna take it off Medicare.com. But yes. So if you fall into catastrophic, it's the greater of 5% or $3.60 or something like that. But most people don't fall into catastrophic. They never reach it. Other people do, depending on the medication. Like this one man, he got one drug. I don't know what drug it was, but it cost him $12,000, and it just went like this. Like he just did all the cycles, in one time filling this prescription, and after it does the whole cycle, I be stuck. Like where do we go back to initial coverage? Because he do the whole cycle paying for one medication. Like, good God, medications are expensive. They're expensive, people. So yes, again, you have stages that you go through throughout the year: deductible, initial coverage, catastrophic, no, donut hole, and then catastrophic. Yes. Okay, so I said in my last video that you can get extra help for paying for these drugs. You can get through Medicaid. So you just go to your local welfare office in your neighborhood or your social service building, apply for Medicaid. All these public assistance companies work together. So we are going to get notified that you're going to get public assistance from your Medicaid. They're going to let us know. We're going to adjust your account. Yes, and then that credit is going to be applied. Your premium is going to be adjusted probably to $0 because Medicaid is picking it up, and then your co-payments for your medication will be adjusted as well. And depending on how far they, like, let's say you got the plan January 1, your premiums, I mean your extra help Medicaid started in, let's say, April, and it's now July. So let's say they credit it back to April. You will get that back in a refund in some kind of way. Either they're just going to credit it to your account, or they're going to send you a check because they owe you that money because you put out, you pay for that money, and now they're just now approving it back to April. So all that you spent from April to June, they give that back to you in some kind of way, maybe in a refund check. Okay. So after Medicaid, you have extra help assistance through LIS or Social Security. Let me say that again. You get extra help assistance. Low-Income Subsidy is the name of the program through Social Security. You call 1-800-772-1213 if you need to apply, and ask how to apply from the appropriate agent, okay? And through this one is a big assistance. Just like Medicaid is a big assistance, this is a big assistance too, but they're assisting in a different way. So depending on your financial situation, it will determine how much they contribute. So if you're on a fixed income, like most elderlies are, I've seen Social Security pay 100%. So if they pay 100%, let's say 100% level 3, I think is the most. I see that they have zero premium, zero deductible, zero copayment, no matter the med. So you can get whatever med you want, and it's not going to cost anything. So let's say extra help level 1, they could have zero deductible, zero premium, but your generic brands could be $3, and then your preferred could be $6. You see what I'm saying? So you have a smaller copay, as well as level 2. Same with the level 2. It could be $6 for your generics and $9 for your brand. Level 3 is zero across the board. Level 4, is there 100% level 4? I think there is 100% level 4. I can't remember exactly what it is. I'm actually look at it tomorrow and see if there's 100% level. I know it says a 75% level, 50%, or 75%, 45%. When it gets to 75%, that's where it gets tricky. I'm not a math wizard. I like it as simple as possible. Did you see how my face got real serious? I like it as serious as possible. But you get what I'm saying. Social Security contributes to how much it contributes determines of how much what your financial situation is. So the lesser you make, obviously, the more that they contribute. The more you make, the lesser they contribute. So that's when they give you the 75%, and it's not really paying really much. Let's just say that. I'm just gonna tell you that now. You still have your deductible that you have to meet. You may or may not have your premium, but I know you still will have your deductible. Your co-payments is kind of iffy. So the 75% is the worst one that you would want. You don't really want the 75%, but the 100% are the best, or great, or great. So we have Medicaid, again, low income subsidy program through Social Security, and you have SPAP. Now, certain states have SPAP. So what is SPAP? SPAP is a state pharmaceutical assistance program, and that is just like, I guess, like Medicaid, and you know, they assist you with paying for your prescription drugs, and they contribute a certain amount. Same process, but certain, it only applies in certain states. Every state don't have it. I don't think Nevada have it, but I know New York is one that I hear all the time. So certain states. So if I was to look it up in WellCare system, I would be able to find what state has a SPAP. I'm gonna try to find it and see, but most likely I would try. I'm gonna look and see if I can find the states that have a SPAP, but I probably won't because that's probably in WellCare system. But I will look anyway. Okay. Um, So those are the main three. Oh, and there's one more. It's called Community Connections Helpline. I don't know if this is specific to WellCare, but I know they work hand in hand with WellCare. That's another number that we give to our members who having trouble paying for their prescriptions. We give them this number. This is a resource program where they assist as well with a lot of different things, just like the social service and welfare office. This is with transportation and food and clothing and shelter, as well as prescriptions and a lot more things. So if you have any if you're struggling with that, this is the number, Community Connections Helpline. Give them a call and see if they can help you out as well. Okay. Okay. I think I may have covered everything. I want to say I think I did. I've covered premiums, I've covered deductibles, I've covered different plans, I've covered different stages, how to break down the medication tiers, extra help assistance. I think I've covered everything that it comes with a Part D plan. Um, so if I forgot, um, leave it in the comment section. If you see this video, leave it in the comment section. We'll discuss it. If you have any questions about Part D plans, what's the best plan or anything like that, or anything else that you think you want to know, or something more that you want broken down, leave it in the comment section. I will answer any questions below. Okay. Thank you again. I hope you guys enjoyed this video. I love giving this information because it's informative. This one was probably the easiest one for me to do because I live it and breathe it every day. The next one I'm going to do is Medicare Part C. I pretty much know that one too because I sell that one. Like this is I'm finna start United Healthcare in 2 weeks. I go to United Healthcare August the 15th, I believe, to start training for AEP again was annual enrollment period. That's when sign up time to start enrolling in the plan. So we start getting our training in. So as soon as October 7th come along, I'll be ready to rock and roll. So yes, I dabble back and forth between both of them. I'm straight PDP right now. In a couple of weeks, I'll be doing Medicare Part C and PDP. So Medicare Part C is going to be easy for me to talk about as well. So I am excited. I enjoy doing these videos. I love letting you guys know what's going on in my mind, in my brain versus, everything else that I tell you guys. So I hope you guys like this video. Give it a thumbs up, like, comment, share, subscribe, follow me on my social media, Keyshawn Reese Robinson, and see you in the next one. Okay, bye.